is a milestone few hospitals have reached, and it's providing a huge benefit to our patients. On today's All Things Heart, we celebrate the technique that eliminates the need for you to go on blood thinners.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Millions of Americans are taking blood thinners as a preventative to avoid blood clots. But these are not a good fit for every patient. So today we introduce you to an alternative that just hit a major milestone right here at the health system. It's called the Watchman procedure. Janine Kiesling introduces us to the 1,000th patient to have it done right here and his medical team that made it possible.
We have a major trip to Hawaii planned for October.
79-year-old Charles Richardson isn't celebrating a birthday or anniversary.
Are you ready, Charles?
This is a celebration of a milestone.
Since you're the life of the party.
Charles is the 1,000th person to have the Watchman procedure.
You get a party hat.
Wow.
At the University of Kansas Health System.
There you go.
I'm hoping because of this procedure that I'll get even more enjoyment out of going on that Hawaiian trip.
It's a big deal. Watchman is a procedure we do in patients who have atrial fibrillation.
Dr. Madhu Reddy says the procedure is perfect for a patient with AFib who should not be on blood thinners due to other health issues.
So the Watchman is a plug which closes the appendix of the heart. And that's where most of the blood clots form. So if you close it, even if you have a blood clot, it cannot come out and cause a stroke.
Charles has had multiple heart surgeries, including a quintuple bypass, valve replacements, and he has a pacemaker. But he also has ITP, a blood platelet disorder that can cause abnormal bleeding. That was the biggest concern for Charles and his doctors.
I'm able to do a lot of things that a lot of 79-year-old people are not able to do. And I'm hoping to avoid, of course, the blood thinners. I don't want to be on blood thinners. And I'm hoping my level of activity will stay the same or increase as a result of this procedure.
The fact he will be the 1,000th person to receive the Watchman procedure under the cardiology team at the University of Kansas Health System was all the reassurance Charles needed. That, plus his confidence in Dr. Reddy.
We have been in the forefront of this field for quite some time, and we'll continue to do it.
Feel nice and smooth. You're just going to push the device out from here.
And we have contributed to science, and our patients have benefited from it, and we're very happy to serve patients.
The specialists here are outstanding, and if they give you advice, go for it. Don't wait till you're in your late 70s to try to fix something that should have been fixed 20 years ago.
We are so pleased to have Charles Richardson joining us virtually this morning. And here in the studio, we have Dr. Madhu Reddy. Dr. Reddy, thank you for joining us. Dr. Reddy is a cardiologist and electrophysiologist here at the University of Kansas Health System. Charles, first question, did you make it to Hawaii?
Yes, we did. Had a 17-day cruise to and from Hawaii, and it was fantastic.
Nice, a 17-day cruise. That's awesome. Now, you're no stranger to heart procedures, Charles. You've had plenty of them. How did you feel after the Watchman procedure compared to previous surgeries and procedures?
Well, it was fantastic. I mean, I got up and basically walked out of the hospital under my own power.
Within an hour, did you say?
It didn't go exactly like that.
Within the day, one day.
Because during the procedure, the wires to my pacemaker were clipped and they had to replace the wires. But other than that, it was routine, I guess.
That's amazing. A routine surgery, something so remarkable, and you were out, Dr. Reddy said, within a day. So what was it about blood thinners that you were so against? What made you choose this procedure over taking blood thinners?
Well, I have chronic ITP, and I did not want to get on blood thinners because I feared that because my platelet counts are very low, that the blood thinners would put me back into another medication that they have to use to keep the platelet counts up where they're supposed to be.
Got it. I want to bring in Dr. Reddy and really get back to the basics here because Charles was also diagnosed with something called AFib. What is AFib?
AFib is a very common and the most common abnormal rhythm of the heart. It's what's happening is normally the upper chambers squeeze and pump blood to the lower chambers. When patients are in AFib, the upper chambers, instead of squeezing, they just fibrillate. And that increases the risk of stroke. And that's why we actually start patients on blood thinners to prevent the blood clot and the stroke.
Okay, so AFib makes you prone to those clots,
Yep.
which is why he would have had to take blood thinners. And there was a risk that you see that Charles saw to being on blood thinners. Is this common with patients that blood thinners are not a good fit for them?
Yeah, it's actually increasingly more common as we age. At around 70 to 80 years of age, about 40% of the people cannot take blood thinners for one reason or the other. And in those patients, in the past, we didn't have an option, but now we have this Watchman procedure. So with this, we will be able to get them off the blood thinners and still protect them from having a stroke.
We have some video of you performing the Watchman procedure on Charles. This was the 1,000th Watchman procedure. Dr. Reddy, walk us through what we're seeing here.
So it's a standard procedure that we've been doing it for the last 7 years. We go from the groin vein, going to the heart, and going to the left upper chamber of the heart. And we all have, just like we have an appendix of our gut, we have an appendix of our heart. And that's the appendix that you see. And here we are opening up this Watchman device to close that pouch, that appendix.
We have some video of the actual device being deployed in Charles. This is so cool to see. This is from Boston Scientific Cardiology. What are we seeing here? This is an animation.
So this is, just here, that's the appendage on the right side of the screen. And we are placing the sheath in the appendix. And then now that's the Watchman device. We just opened it up. So this is a cartoon animation. And it goes something like this in almost every patient that we do.
And it stays there.
And it stays there.
You leave it there.
We make sure that it is fitting right, and then if everything looks good, we release it there. And then it just stays there for the rest of a patient's life.
How big is it actually? Can you show me?
It's a size of a quarter.
And is it
and then when you
cylinder?
open it up, it becomes elongated. When the appendix shape, every patient has a different shape of the appendix. So this is a newer device, and it takes the shape of the appendix.
Of the appendix in the heart.
Yes.
So it's a little cylinder, and it kind of
it's a
opens
cylindrical structure which opens up, and there we can see that.
That is so
It looks like a
interesting.
strawberry when you leave it there.
Oh, wow. Charles, what's it like watching this video and knowing that this happened to you? This is in you.
Well, it's totally amazing. I'm in awe as to the procedure that they went through to make it happen.
You say you wish you would have done this 20 years ago. That was your advice to people. Don't wait for something you wish you would have done 20 years ago. Were you suffering for a long time?
Yeah, I really, it started back in 2017, and it's when I first, in that area, I had my first open heart surgery. And then they found I had 5 bypasses in addition to that, and a pacemaker.
Wow.
Fast forward a couple of years, they said, well, your heart valve's failing. We're going to have to replace that. So I went from, I believe, a pig valve to a bovine valve, had that done. And then we went on from there, and they started talking about putting me on blood thinners, and I was resistant to that because of the ITP. And fortunately, I got the good doctor here to intervene and kept me off of blood thinners.
That's incredible, and it's incredible that you were the 1,000th patient for this to be performed. You also have another procedure that we want to talk a little bit about this morning. We have video of you performing this. What is this called that you're doing right here, Dr. Reddy?
So this, I believe this is the ablation procedure. So patients who have atrial fibrillation, the Watchman was a procedure to prevent the blood clots and prevent a stroke. AFib ablation is a procedure to prevent AFib. So we're trying to decrease the chance of AFib happening again. So we go ahead and do what is called as an ablation procedure. We try to eradicate the abnormal signals in the upper chambers of the heart. And this is a new device. This is the first time it's been used in the metro or in the actually neighboring several states.
And it's called the FARAPulse?
It's the FARAPulse, yeah. It's a new device. It's a revolutionary technology that has come up, and it's going to be the future for most patients who undergo ablation.
What are you wearing in that video? It looks like you're in a big box or a big bag over you.
Yeah, that's called zero gravity. It's basically for radiation protection. Instead of wearing a lead and doing the procedure, we use that thing to prevent radiation to our body.
This is super exciting. It's super exciting for our heart patients here at the health system. It's so exciting that we have an entire program planned on the FARAPulse in a few months. So we're going to drag you back here with a patient. Love watching that and seeing just all the developments that happen so quickly. So stay tuned for that episode. That's a future episode. In the meantime, we love when our viewers send us questions and comments. Our doctors love answering those questions. You can connect with us in real time on YouTube, Facebook, the X platform, or the All Things Heart email. You'll find all those links right there on your screen. And we do have some questions that have already come in from some of our viewers, so I want to get to those. Patty wants to know, Dr. Reddy, does this cure AFib?
It does not. It just, there are some consequences of AFib. The biggest consequence of AFib is a stroke. So it prevents the risk of stroke. It dramatically decreases the risk of stroke. It's not always zero, but more than 90% of the strokes can be prevented by this procedure.
But it won't cure the AFib.
It does not cure the AFib.
I have a question from Deborah. Deborah wants to know, she writes, she wants to share this with you. Just in time, as my husband just had emergency surgery for a blood clot. Wow, that's interesting. Layla wants to know, are there any risks associated with having the Watchman procedure?
Yes. Like any cardiac procedure, there is always going to be some risk, but the risk with the Watchman procedure is much lower, and it has been improving over time. Our average risk of something going wrong with the procedure is about 1 to 1.5%. So 98% of the times, people do not have any complications. Most of the times, it's related to bleeding from the groin from where we go in.
Charles, were you in pain? Were you in pain, Charles, when you came out of the procedure?
I didn't have to have any pain medication at all.
Yeah.
Is that normal?
That's normal, yeah. So we do, because we're doing only one axis, and the entire procedure is about an hour, and my part of the procedure is only about 20 minutes or so.
And what's the Watchman made out of?
Nitinol is the main frame, and then there's a fabric on top of it.
Does it show up on when you go through any of those scanners at the airport?
No, it does not.
You don't look like the bionic man. And Charles, were you back to normal right away? You walked out of the hospital within a day?
Yeah, I basically resumed normal activities when I got home. I mean, yeah, I didn't have to have physical therapy or any of that.
Tim wants to know, how long does the Watchman last?
It's a once in a lifetime thing. We put it in once, and then it stays there for the rest of the life. In fact, after staying there for a few weeks, heart tissue grows on top of it, and it becomes a part of your heart.
Oh, wow. And do you have is it typically people in their 70s or older that are getting this procedure? Or do you have young people getting this procedure as well?
We also have younger people. So the risk of stroke with AFib also increases with age. And the risk of taking the blood thinners also increases with age. So generally, we have people who are more than 65, but we also have young patients. For example, if someone has atrial fibrillation and they're a pilot, and the risk of bleeding for them will be higher, so we encourage them to undergo a Watchman procedure.
Anne wants to know, this is an interesting question. Anne writes, does someone have to have AFib to get the Watchman? Because, she says, I'm prone to blood clots, but I don't have AFib, so can I get the Watchman?
No, so Watchman is only for patients who have atrial fibrillation.
Only heart patients, not for anyone with a clotting disorder.
Yeah, that's correct.
And why is that?
Because what we're doing with the Watchman is just that closing that appendix or the appendage of the heart. And blood clots in the appendage of the heart happen only when they have, or almost everyone has AFib. If you do not have AFib, that's not the location where you have blood clots. The location of blood clots would be in the legs or the veins of the legs. And Watchman procedure would not prevent those blood clots.
Oh, okay. And Lisa has a question for Charles. Charles, Lisa wants to know if you have any restrictions because of this.
No, I do not. Just the normal restrictions that I have from the open heart surgery, where they don't want me picking up real heavy things and, over stressing or anything like that. I have a yard that's over an acre, and I maintain that yard with multiple oak trees that causes a lot of yard work, and I don't have a problem with it at all.
What do you think about hearing that?
That's awesome. That's what we want to hear. We want to make sure the patients are doing well and they're able to do what they love the most.
To get back to living.
Yep.
As you were going into this procedure, Charles, did you know that this was a big deal, that you were the 1,000th?
I'm sorry, I didn't hear that, please.
I was asking if you knew, heading into this procedure, that you were the 1,000th patient to get this procedure.
No, I didn't know that until they approached me in the hospital and said, would you be willing to participate in this? And I said, absolutely.
Why was it so important to you to share your story?
Well, I think anybody that has been afflicted or find themselves in this position should consider having this procedure done. Now, I will add, as Dr. Riddy said, it does not cure AFib completely, so I still have occasional periods of AFib, but my cardiologist keeps a close watch on that and, in fact, contacts me directly when they see a flare of AFib. Generally, it's because I've gotten very emotionally involved in some situations, and that makes it flare up. But by and large, I don't have a whole lot of that anymore.
Is it usually talking politics? Is that what flares people's AFib? I'm kidding. You don't have to talk politics. Please don't. We'll stick to the medicine here.
Maybe that's one element of it, but yes.
Keep it smooth. Roger has a question for Dr. Reddy. He wants to know if Medicare pays for the Watchman procedure.
Yeah, so Medicare has qualifications. We want to make sure that, obviously the patient has AFib and there is a risk of stroke and there is a reason why they want to come off the blood thinner. There should be a rationale to do that. So that's why we don't implant Watchman in everyone who has AFib. It's only those patients who cannot take blood thinner, like Charles. And there are multiple reasons why people cannot take blood thinners. Most common reason is actually bleeding. Because when you're on the blood thinners, you can have
to wear the bracelet, you can't get bruises, you have to monitor yourself. I don't know if it's possible if we can pull up the video again of the animation of the Watchman, because it was so clear, and I would just love to take a look at that again if we can. I know I'm putting our amazing technical team on the spot. There you go. They delivered. This is incredible. Has there anything in this that has changed since your first Watchman procedure?
Oh yeah, since my first, this is a third generation Watchman.
Okay.
And the first ones, they were designed completely different. There were higher risk of complications, and also the number of steps we do to implant it are fewer now. So we just go with single access. In the past, we used to go exchange with a different sheath and then get the Watchman. And then we were also, because it was new, we were taking more time to make sure we understand it properly. But now it has become obviously more than 1,000 procedures. So the comfort of the procedure has actually gotten much better.
It looks like a whisk, a little miniature whisk that you're putting up there, and it's covered in something. So that detaches, that pulls away, and then that's inside Charles now for the rest of his life, helping him live a normal life.
Yep. That's correct.
That is amazing. When did you start performing these procedures?
So 2015 is when FDA approved it, and that's when I started doing them. Yeah.
So for 9 years now,
9 years.
you've been doing this, and things are already changing. Amy had that incredible video of you with the Ferropulse, which we're going to dive into again at a later episode. As we wrap up this discussion, I want to ask Charles. Charles, what is something that you would like to say to someone who's watching who might be considering this procedure?
I would say do not hesitate. And KU Med Center is a place to go. We live 200 miles south of KU, and the services and the good doctor here are excellent. Don't be afraid of it. There's no pain involved, and it is a wonderful procedure, particularly to keep you off of blood thinners.
Blood thinners. And Charles, I should ask you, where are you joining us from? Are you joining us from your home?
I'm sorry, I didn't hear that.
Where are you joining us from today for the discussion?
From Lebanon, Missouri. We're about 25 miles south of the Lake of the Ozarks.
Got it. And how did you discover that Dr. Reddy could do this procedure? Living 200 miles away, this isn't around the corner from you.
My cardiologist is associated with KU Med Center, and he recommended it.
So your cardiologist is with the University of Kansas Health System, and he recommended you. So you treat people all over the region.
Oh, yeah.
All over the region. Dr. Reddy, we're making leaps and bounds in this area. What's your dream for the future? What do you hope to see for the 2000th Watchman?
Oh, Watchman has become the standard of care at this time. What we are looking at, so as of now, we are still implanting in patients who cannot take blood thinners. So there needs to be a rationale to do that. We are doing studies right now, and we are awaiting the results of them, where it may be for everyone. So anyone who has AFib, they may benefit from the Watchman device, and they don't need to have a reason to come off the blood thinners. So that's what the next generation of studies are showing up. We'll see how the results will be. Its data is not out yet.
It's an exciting time to be alive. And we also want to celebrate another milestone, because this procedure hit a milestone with the Olathe Health Cardiovascular Center at Olathe Medical Center. They hit 400 Watchman procedures. So they had a big celebration for their 400th Watchman procedure. And they had a fantastic looking bundt cake. That's got to be nothing bundt cake. That's my favorite. That looks like lemon too. Delicious. Bring us a slice, Olathe. The hospital is now part of the University of Kansas Health System, so we are so excited to our friends and colleagues at the Olathe Medical Center. Congratulations. We love sharing the incredible work of our doctors here at the health system, and we also love showing you what life looks like for them outside the hospital walls.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
We're going behind the mask with Dr. Reddy. Let's take a look at some of the beautiful pictures you submitted, because you're a busy guy. You got a busy family. Who are we looking at?
So that's my wife. She's a physician, a pulmonary critical care physician, and those are our twins, 13-year-old twins, a boy and a girl. We love them to death, and these are my friends. Many of them are cardiologists. In fact, one of my best friends is joining the hospital.
Oh, nice.
Next month. Yeah.
What's his name? Her name?
Dr. Soma.
Okay.
He's an electrophysiologist in Tulsa right now, so he will be joining University of Kansas Health System.
It's like it's a small group of people that know each other all over the country. Your wife's a doctor too. What does she do again?
She's a pulmonary critical care physician.
So when you go home, what do you watch for entertainment? I'm guessing you don't watch like any of the Chicago Med or any of that, or do you?
No, I don't. The kids want to watch something, so I end up sitting with them and watching, but otherwise,
what do they like?
Oh, right now they're watching Big Bang Theory. So
oh, nice. I love the Big Bang Theory. And you have 13-year-old twins. 13 is a difficult age. What's it like to have two of them at once?
Oh, they're good. They're good kids. So we spend as much time as we can with our schedules, but we travel a lot. That's one of our favorite. Whenever we get some time, we just travel out.
Some of those were travel pictures that we showed. Where was your favorite place you've been to with them?
So our favorite place has been Grand Cayman Islands. So that's nice. They love the beach, and we love it too.
It sounds really nice when it's March in the Midwest.
Yes.
And it's been cold and gray, although it's supposed to be a little nicer today. Well, thank you so much for sharing a slice of your family with us and this incredible medical advancement and milestone that we hit. And Charles, thank you for sharing your journey with our viewers, because you're going to help a lot of people and you're helping us learn about these new things that can really change lives. You going to go work on your...
I could be a part of this. Thank you.
Are you going to work on your yard now? It's supposed to be beautiful today.
Absolutely. It's go out and pick up the sticks and limbs that blew down from the storm last night.
Well, I don't mean to put you to work. I was just genuinely curious if that's what you're going to do today. If you have more energy, though, you can take the drive to Kansas City. We need some help, as long as you're feeling better. Thank you, Charles. And thank you to our viewers for watching us today. Coming up next week on All Things Heart.
And all of a sudden, I get a ripping chest pain.
A ripping chest pain that wound up being a tear in a major artery. You'll meet the woman who faced a deadly condition, survived it, and is now using that experience to inspire and educate others in a pretty remarkable way. That's next Thursday at 8 a.m.
Coming up tomorrow on the Morning Medical Update. Life after long COVID. What does recovery look like when an infection triggers a much bigger problem? I'm Jessica Lovell on the next Morning Medical Update. An update from Michaela Dreyer, still being treated nearly 4 years after her infection. Friday at 8.